Here at the Positional Release Therapy Institute, we often see patients complaining of foot pain. Many are diagnosed with plantar fasciitis, which is a common occurrence among runners and those who have essentially overloaded their foot with too much too soon. And that pain is often very hard to treat. However, what we would like to show you is a patient self-treatment technique that will help alleviate pain and will complement the therapy that patients often pursue, and if not, sometimes will even alleviate the pain completely by itself. The common treatment for plantar fasciitis is actually to stretch the fascia, which originates from here and spans across the foot. However, what we find often is that stretching tends to aggravate the tissues and also pull on the muscles, further causing pain. So the approach for plantar fasciitis, as well as general arch pain, is to actually not lengthen the muscles and tissues, but shorten them. By shortening them, it's much like taking a knot out of a chain necklace. Instead of tugging on the knot, which neurologically for tissues often will cause a protective muscular spasm, resulting in more pain and also resulting in more tightness, our approach for releasing these tissues, and there's two particular that tie into the plantar fascia, which is your flexor brevis muscle and also your abductor hallucis. So a general plantar foot release that we prescribe to our patients is placing the ankle on the thigh, taking the heel with the thumb and pushing it down, then taking the toes and cradling them in your hand, providing slight pressure, squeezing the toes in together, and then now pulling and compressing the tissues together. As we can see, the tissues now are more relaxed, they're not stretched, and we subscribe or prescribe to our patients to hold that position for 3 to 5 minutes daily. And more importantly, not to put their foot down directly on the floor after the treatment, because the arch, when it goes to make contact with the floor, will collapse and it will stress the tissues, often causing a re-aggravation or re-spasming of these tissues. This should be performed daily, ideally in the morning upon waking before even putting the foot down, in addition any time a patient has pain for maximal release.